From St. Louis, Missouri, this is Connect with Jade Harrell. Connect with Jade Harrell is all over Missouri in the pursuit of zero health disparities. And leading the way is the Regional Health Commission and Alive and Well Communities. They are taking us on a tour from St. Louis to the Boot Heel to KC to talk about how we can all experience our greatest health outcomes and best life possible in Alive and Well life. I'm joined by Angela Brown, the CEO of the Regional Health Commission. Angela, so great to be here in the headquarters.
Excited to have you.
So there's a lot to have come, and I've asked everyone about the origin story. We started some years ago, had this harebrained idea for a radio show, Alive and Well STL, became Alive and Well Communities, a whole other nonprofit organization doing some more great work that really stemmed from the power and work that you all have done. So take us back to the beginning to share the story. For those who haven't met the Regional Health Commission, can you talk about the work you do and how you came to it?
Yes, so we were created after the closure of the last public hospital in St. Louis by Civic Progress. At the time, created a team of health leaders and community leaders to come to the table to understand the disparity that would be left with that huge closure of that hospital. And so from that work, the recommendation was to have a body. We were supposed to be temporary, that would find a solution to ensure that those who were uninsured had access to health care. And so we've been here for 20 years. Also.
Now, you weren't here on day one.
I was not here.
Because you would only be 26 if that were happening.
I have been here a while.
Yes.
So almost 16 years now. So I've been here quite a bit. And the first thing that they did was to help reorganize the infrastructure for primary care. And that transformation was able to see over 100,000 increase in visits. And so we wanted that same work in behavioral health. And so we started with an initiative, Eastern Region Behavioral Health Initiative, that brought me here to really think about how do we transform behavioral health and make sure that those who need the services have access.
We'll be right back. Are you enjoying the show? We'll show support for those that make it possible. Take a look. Connect with Jade Harrell is made possible by Rare Gem Productions with Tinfinity, Life and Levels Luncheon Series, and the annual Jade's Faves Birthday Celebration Extravaganza. December 8th at View 17 in Brentwood. Find, fuel, and free your frequency to live life at your greatest levels. Visit tinfinity.com, 10finity.com. And CKH Financial, St. Louis-based registered investment advisor firm, RIA, a financial advisor you can trust. Call 314-477-1482. 314-477-1482. And from Locks of Glory Salon and Spa, celebrating a grand spa reopening. Get ready for an incredible spa experience. Visit locksofglory.com for details. locksofglory.com. Let's define for our viewers behavioral health versus physical health versus mental health.
Yes. Yeah. So when you think about healthcare, most of us understand the whole body. Healthcare and the way we fund healthcare is a little behind. And so we fund primary care, looks at kind of your physical health, heart, hands, feet. And then when we think about behavioral health, that's when we think more about that mental, emotional wellness. Substance use would fall into those categories. And so we say behavioral health kind of combines things that happen to us mentally, and then primary care thinks physically. Thankfully, we're moving more to an integrated approach because we understand that's how we operate as people. As whole people, our mind and our bodies usually show up together.
That's true. That's true.
And trying to treat that whole person at the same time.
I love how you said usually. Yeah. I've had where one or the other decided.
Some days,
yes,
your mind, you might leave it at home, but you're physically here.
Indeed.
We understand that, but people do have, we exist as whole people, and so our healthcare system is trying to catch up with that. which was, when we think about the work that we do for Alive and Well, is really thinking about the whole person.
Sure.
Understanding their history, their trauma. And then when they're presenting in front of a doctor, we know you're just here to look at our blood pressure or deal with the pain that we're experiencing at the moment. But understanding that a lot of times the physical pain that we're feeling is a result of some of the emotional wellness and mental things that are happening. And so the work with Alive and Well really helped us bring that story alive for individuals. And really help people.
Oh, I'm so proud.
How we think about individuals' trauma, what's happening at home in their environment, if they don't have food, if they're in violent relationships, and all those things that happen when you don't have resources and you're struggling to make ends meet, that results in some of the physical symptoms that show when we arrive at the doctor.
That's right.
And how do you treat that whole person?
So that's where the integration comes in, because I have all that going on. Next thing you know, my blood pressure is sky high. My headaches are raging. I don't feel vibrant or ready to take on the challenges of my day. And I go to the doctor and say, well, maybe it's my knee. So those things do matter. Now, Alive and Well was your way initially to tell this story, to have this conversation. And then they went off and tried to be teenagers. and grow up without you, but did some great work. And that's how we are going on tour to the Boot Heel, and that's how we're going to KC. Now, the Regional Health Commission will be at home waiting for the kids to come back and do. How will bringing Alive and Well back under the fold look differently now than it did when we first started?
Things will be different because when we first started Alive and Well, our focus was really on making sure that those who didn't have insurance had access.
So basic coverage.
Understanding that in St. Louis City and St. Louis County. And at the time, Alive and Well had expanded beyond healthcare to education because of a lot of things that have happened with Michael Brown and other things.
Community trauma, toxic stress. We started, new studies came out and said we're walking dead. No. But that the things that we are experiencing are really affecting our health, can make us sick.
Really, and that impact grew, right?
It did.
Them expand over to Kansas City, and so they really got outside of the scope of the Regional Health Commission. Thankfully, Medicaid passed in our region, which we are very excited about, and people now have coverage, at least a more sustainable coverage option at Gateway. And so with the end of Gateway, as a organization, as a board, we had to rethink, who do we want to be? Now that we're in this next phase of life, do we go away? Do we stay here? Is there still a need? And we all agree that...
Because they felt like you had checked the box. Okay, mission accomplished. We've gotten here. We expanded. We did it. People know. We came, we saw, we conquered.
We did what we were supposed to do, right? We achieved our goals.
Okay.
But understanding coverage is just only one barrier to access, is what the board said. And how do we begin to look at that to get more upstream, right? Be more prevention and really get to this whole goal of zero health disparities.
More with the St. Louis Regional Health Commission and Alive and Well communities right after this.
For nearly a decade, Serenity Memorial Chapel has offered families compassionate services during their time of need. Serenity understands making funeral arrangements can be difficult and challenging. In your time of need, you can rest assured Serenity will provide you with affordable and high-quality service, be it cremation or traditional service. With Serenity, you will experience exceptional care for you and your loved one.
With convenient locations in Missouri and Illinois, we can now better serve you. At Serenity, elegance can be affordable.
And so we boldly said we want a community with zero health disparities that centers the community, which is very different for us because our table is
the other way around.
Hospitals, health centers. We have leaders at the table of organizations. And so really saying that we want to center the voice of those with the lived experience as part of our way to get ourselves into zero health disparities.
That is bold. But what I really like about it is I had the vision as you were talking about it, community in the middle. And the people who said, hey, this is the work I love. This is the work I want to do. This is how I want to help people. Like I asked a nurse recently, why would you do such a thing? She says, I've always wanted to help people. So I envision that now they're listening to, taking on and saying, how can we best bring those things we love, can do, and can affect to the people that we most who need us most, who we said we serve.
And if there's policies and practices that are preventing that, how do we come together to advocate to get those changes and move the resources where they need?
And you've had a successful track record in that.
We have. And
Because let's just, again, shout out Medicaid. Hey.
okay.
Yeah.
How do we do more of that? Like, that is a big win for our community. People were able to take their voices and say, we need this care. How do we amplify that across our system?
That's a huge part.
We need this, and you need to make sure that we have what we need.
For sure. Well, the Regional Health Commission, I believe, is how that's amplified.
Yes.
And then bringing Alive and Well communities with you to not only amplify, but to engage community, to engage partners. I think you might have something.
We might have something. And thankfully, then we are able.
Can't hurt to try, right?
And we're leaning in.
Yeah.
We're willing to fail and figure it out.
Okay.
But as long as we understand we're together figuring this thing out and trying to get to the best solutions for all.
What does it mean to you to be alive and well?
Being alive and well means the ability to sleep. And I say that because that is peace.
Huge.
It's without worry. And I think people underestimate the amount of baggage that we have that prevent us from just having a normal night's rest.
Yeah.
And so for people to be able to sleep with peace and quiet, knowing that their safety is alive and well to me.
That is. It sounds delightful to me too. Zero health disparities and glorious rest. Get connected. Alive and Well communities and the Regional Health Commission are connecting, and it's going to be incredible. We're going on the trip. You stay with us all month long for zero health disparities and health justice as well as equity. Good news. I don't pay attention.